So for my CAT assignment, I was looking at whether or not massage therapy would be beneficial to relieving symptoms of post-traumatic stress disorder. So post-traumatic stress disorder is fairly common. Almost 1 in 10 people in Canada are going to have it at some point in their lives. So that's why I was interested in taking a look. The main limitations that I noticed in the body of literature that has been so far done in regards to this is that there's a lot of comorbidities in most of the studies I was able to find. So we're not looking at just PTSD, which I think is fair because PTSD does have a lot of comorbidities, but that's something to keep in mind. That most of the studies have been done on veteran populations, probably for just ease of research purposes. Anyway, there were 3 studies that I included in the final CAT report. One is a Davis et al. Study, which does conclude that massage therapy is beneficial and has an immediate beneficial effect directly after treatment. Gibson suggests that not only are individual circumstances going to affect treatment outcomes, but that the interventions that manual therapy and massage therapy can provide are effective, and they're often more effective than drug-based therapies, and have less associated risks. So it's a healthy choice, and even though the outcomes might vary between individuals, they aren't going to hurt that person. So massage therapy is never going to be harmful to somebody with PTSD, and so it should be at least considered as a potential treatment. And the last study I looked at is the Sumpton and Baskwell study, and this was looking specifically at sleep, and it seemed that massage therapy did not affect people with PTSD and their symptoms dealing with insomnia. However, and all of the participants liked receiving the massages and reported a feeling of wellness. So even though they found that it didn't really help sleep, it probably did have a positive effect that this study wasn't looking at. In the end, the conclusion that I came to through this research is that yes, massage therapy can be beneficial to people with post-traumatic stress disorder, but their particular current living situations, as well as other comorbidities they have, might affect that.